time it is. Marvin Devine, Huber, Axel, and you know how we do.
Yeah, I got the juice. Whip game cool, make them look like cool. Always play cool, that's the biggest rule. Forget what they doing, keep on doing. I've been making loot since like 22. Ask me how I made it right here in the booth. I'm always pursued cause of what I pursue. That's greatness, yeah, I gotta make it, I got things to lose. Boy, wanna get in my crew, but you can't get in my crew. Me, Axel, and Huber way too fireable. When this joint drop, better call the truth. And when you hear the drop, better raise the roof. Better raise the roof.
You already know what happens when we link up. Let's go.
Yeah, I got the
Hello and welcome to Kidney Hub East Africa, the home of kidney education, advocacy, support, and empowerment. I'm Steve the Kidney Nurse, and today we're talking about an issue that affects many families, kidney transplant, from waitlist to a new life. Joining me in the studio is my co-host, Moses Kennedy, also known as the Kidney Ambassador. And we also have our guest co-host, Tabitha Matekwa. And of course, we are honored, and I really mean that, we are honored to be joined by a man with deep experience in kidney care, Dr. Hussein Bagha. Before we bring out our co-host and Dr. Bagha, let me go over our medical disclaimer for the show. Now, as you know, we don't claim to be doctors over here, right? But the information broadcast on Kidney Hub East Africa is provided for educational and informational purposes only, and is not intended or implied to be a substitute for professional medical advice, diagnosis, or treatment. Now, with that out the way, let's bring on our co-host live from Nairobi, Kenya, the Kidney Ambassador and renal nurse specialist, Tabitha Matekwa. And let's give them the VIP co-host intro. Welcome, Moses. Welcome, Tabitha. How are y'all doing today?
Thank you so much. I'm doing great.
Tabitha, how you doing?
So, well,
Can,
had a great day.
can you hear me?
Yeah, I can hear you.
Good,
I'm
good, good.
fine. I'm doing well.
Oh, that's good.
Yeah.
Glad to have both of you on the show to talk about this important topic when it comes to transplant, not only in East Africa, but in Kenya as well. So let me go over the background of our distinguished guest. Dr. Bagha is a consultant physician and nephrologist at MP Shah Hospital, where he serves as head of the renal and transplant unit. And let me tell you something. Why I'm so appreciative of Dr. Bagha being here, because we could rarely get the attention or head of a transplant unit to come on a podcast like this, because they're so busy. They're so busy with their personal life. They got children, family, and not only that, with their professional life. And that's why I'm so appreciative of Dr. Bagha being here. I don't know about you, Tabitha, or you, Moses, how it is in Kenya to have a distinguished guest on the podcast, but I'm truly appreciative.
We are honored.
Yes. So Dr. Bagha, not only does he serve head of the transplant unit, but he serves head of the Department of Internal Medicine. So he got his hands full. He's head of 2 departments. He trained at Aga Khan University. I hope I'm pronouncing that right. And he later specialized in nephrology at the University of the Witwatersrand in South Africa. And I hope I pronounced that right. I looked it up before on Alexa to find out if I'm pronouncing it right. But he also completed his MRCP in nephrology. Dr. Bagha is a member of several respected medical bodies, including the Royal College of Physicians in the UK. And let me tell you something. He picked a good place to go, because in the UK, kidney disease in the UK mimics almost the kidney disease in the United States. It's prevalent. And he also was at the Royal College of Physicians and Surgeons of Glasgow. He is also a fellow of the International Society of Nephrology, ECSA, and the Royal College of Physicians of Edinburgh. So he has extensive training in the United Kingdom, bar none. He has also presented widely at international forums, and his area of interest include kidney transplantation, cardiorenal syndrome, and diabetic kidney disease. He has also been honored with the Order of the Grand Warrior and the National Heroes Award. Please, let's welcome our special guest, Dr. Hussein Bagha. Let me give, he definitely deserved the VIP guest intro. Hi, Dr. Bagha. Welcome to Kidney Hub East Africa. We're truly glad to have you with us. How are you doing today?
I'm doing quite well, thank you. How are you?
I'm doing great. Thank you for joining us. As I mentioned before I brought you on, it is truly an honor and pleasure to have you on because I'm looking at your background and I'm looking at all those books. But I know your time is definitely controlled. You have patients. You were in charge of two departments, and so I know your time is very limited. So again, thank you so much for coming on, taking the time out on this Sunday evening to you know bestow us with your presence. And so, Dr. Bagha, let me begin with a basic but very important question. For many patients, kidney transplant sounds like the best hope. What exactly is a kidney transplant, and why is it so important for people with kidney failure?
So that's an excellent question. So kidney transplant is a surgical procedure which entails us removing a kidney from a healthy person and implanting it into somebody who has got end-stage kidney disease. Or, and this is called living donation. Now, there's also something called deceased donation, where in some countries where the program is available, what it entails is if a person has already given consent when he or she was alive, that in case if he or she passes on, then his organs can be donated for transplantation. Or when the family agrees for that person's organs to be donated, then we retrieve the kidney from that person and subsequently implant it or transplant it into somebody who has got kidney failure. Now, we know that the kidney is a very important organ in the body. It has multiple functions, including it cleans the blood, it removes all the toxins from the blood, it removes all the excess fluid from the blood, it regulates your hemoglobin levels, it regulates your electrolytes like sodium, potassium, calcium, magnesium, phosphorus, among many others. It is also important in the synthesis of vitamin D. It helps to control your blood pressure as well. So when your kidney is failing and you reach end-stage kidney disease or what is called stage 5 kidney disease, then you have to be on what is called renal replacement therapy, meaning that either you go on to what is called dialysis or you go for a kidney transplant. Now, both of them are forms of renal replacement therapy. So dialysis entails you having to go to the hospital, especially where you're doing hemodialysis, which is hemo stands for blood. And dialysis is basically the cleaning of the blood. So it entails you going twice or 3 times a week to the hospital, whereby you are connected to a machine, blood flows out of your body into the machine, it is cleaned, it acts as a surrogate kidney, and then the blood is then returned back to your body. Now, when you look at the way how a normal kidney functions, it functions 24/7, round the clock. Whilst when you're undergoing dialysis twice or sometimes thrice in a week. So definitely it is not the same. So you do tend to still have the effects of the kidney disease. Your level of blood has to be boosted. Your acid-base levels are not optimum. Your vitamin D levels, your other electrolytes are also not optimum as well. So, and your quality of life is also not good as well, because 2 or 3 times in a week, you have to be present at the hospital. You have to be hooked onto the machine. You miss work. You can't enjoy life as somebody else who is not on dialysis does. Travel is kind of difficult and restricted. So when somebody goes onto the transplant basically helps somebody to live a normal life like somebody without kidney disease. Of course, you're supposed to take your medications, what we call the anti-rejection medications, that help your body not to reject the new kidney because it's a foreign tissue. And of course, you have to be careful about what you eat, what you are, the people you interact with, and making sure that you are safe. So the kidney transplant improves your quality of life. You're able to function normally. You don't have to go to the hospital every 2 or 3 times a week. You're able to get back to work, and it improves your longevity as well. So if you compare somebody who's on dialysis versus somebody who's on transplant, the person who's on kidney transplant, who has had a kidney transplant, actually lives much longer. So that's the reason why a kidney transplant is actually preferred. Yeah.
Oh,
Sorry, I think, Steve, you're muted.
Oh, sorry about that. Thank you for sharing that. Brother Moses, is on you.
thank you so much, Dr. for showing up. I just have this question. Yeah. Many patients and families in Kenya hear that transplant is possible, but then they run into the issue of finding a donor. What happens when a patient does not have a family member who can donate a kidney?
Okay, that's also another very important question as well, which I keep on getting asked. And the reason why we have currently insisted that it has to be a family member, of course, we do make exceptions. Now, by a family member, we mean either your immediate family, like your parents or your children, your first cousins, second cousins, up to your third cousin, as long as you can say that, you can show the documentation, are allowed. Your spouse is also allowed to donate as well. Now, the reason why we have made it a bit strict about it being a family member or somebody who is related to you is to ensure that it is done willingly. Now, we do tend to get cases where 2 people come and they're like, oh, I don't have any family member who is a donor, and this is somebody I've met, let's say in a church group, and he has just come and volunteered. And of course, it raises a lot of ethical questions, and as to we have to make sure that there is no coercion involved, there is no exchange of money, because the law worldwide does not allow you to buy or sell your organs. Now, you can take an example of somebody who brings his Shamba boy to the clinic and says that he has agreed to donate. Now, definitely, if you can't verify whether this is truly an altruistic donor. Altruistic means that from the goodness of your heart, you're not expecting anything in return. But now if you look at the dynamics that this is your employer and you're the employee, and you're worried that maybe he has asked you, and you're worried that if you don't agree, then you might lose your job. So to make sure that we don't run into such conundrums, that is why we have advocated that until or unless we have robust legal, the laws present to protect the donors who are not related, it would not be advisable for us to proceed with that. Of course, we do make certain exceptions. Like, for example, if somebody comes to me and I go through the whole family and we see that nobody is actually a potential or a suitable donor, and then we actually approach our ethics committee, and we approach our umbrella body, the Kenya Renal Association, as well. And this has to be discussed and agreed upon to make sure that everything is being done altruistically for the person who is willing to donate. And then that's the only time that we do agree to proceed with the kidney transplant.
Wow.
Thank you very much, Dr.
Wow.
Bagha, for coming on board and for sharing so much insight on transplantation. I've seen many donors come the same way. The Shamba boys trying to give for free, but some of them maybe they are coerced. Just maybe to ask you, in case we have we have relatives and they have maybe medical condition, or maybe they're not medically fit. What could be other options maybe that you can recommend, maybe they are available for the patient?
Yeah, so you see, a kidney transplant is never an emergency. That's the one thing that we all have to realize. Okay, I always tell my patients, even when they have a donor and everything, that even on the day of their kidney transplant itself, we can cancel the transplant in case if we find that maybe the transplant recipient is not has something that has happened, like for example, has developed a viral illness, or might be find that the blood levels are not okay. And we have canceled a number of transplants based on that. And we always advise them that, look, it's basically for your own benefit as well. So it's never an emergency. So even if you go through one kidney donor and you're not able to get transplanted, and possibly the donor is rejected because of a medical condition, remember, in Africa, we have very many big extended families. So it's always important to talk to your extended family members as well. And sometimes even having a meeting with the extended family members, with the doctor, with the transplant coordinator, explaining to them that it is perfectly safe to donate your kidney because you will not end up with kidney failure. And this is why there's a very rigorous process that we use to select a kidney donor to make sure that he or she is going to be safe after the donation. He or she will not develop kidney disease after the donation. So it is really, it is quite safe for them to donate. So when they hear it from the doctors, or when they hear it from the transplant coordinators, and sometimes also from the donor support groups as well, the transplant donor support groups, like for example, at the MP Shah Hospital, we have a transplant support group as well, where people share their stories, people share their experiences as well. So that really helps as well. Sorry, Steve, you're muted again.
I'm sorry. Yes. Wow. Okay. Dr. Bagha, let me ask, before someone gets transplanted, there's usually a lot of preparation. What are the main steps a patient goes through before being approved for a kidney transplant?
So are you asking from the donor side or the recipient side?
Recipient.
So definitely, yes. So from my side, every patient with end-stage kidney disease is supposed to be considered as a potential transplant recipient. Of course, there are some cases where they cannot be transplanted for one reason or another, either because it is something medical. For example, they have severe heart failure, or they have had a heart attack within the past 6 months and we have to wait. Or if they have an active malignancy as well, then we can definitely not transplant them until the malignancy is treated. And then after that, they have to wait a specific period of time. However, if they don't have any of those contraindications to a kidney transplant, then basically we need to assess their clinical suitability for a transplant. So we have to assess their cardiac or their cardiovascular status. They have to make sure that we do an ECG and echo. If it's a diabetic who is more than 40 years of age, then we do stress tests for them. We make sure that they don't have any active infections going on, or any active cancers or malignancies going on. They have to be physically fit as well. So if they meet all that criteria, then definitely we do proceed with the workup for the kidney transplant. So that is just going to be the baseline workup for that particular patient. Yeah.
Okay, thank you for that.
Thank you, Dr. Dr. Let me add one more. One of the biggest concern people have is fairness. How does the requirement for a related donor affect ordinary patients who are ready for transplant but have no suitable family donor?
No, so again, it basically depends. You see, by the time that you are coming in and requesting for a kidney transplant, you have to come with the potential donors. And remember that thankfully in our African families, we do have quite a number of family members. And now, even starting the conversation, even with your closest family members, is one of the most difficult things. And this is why I consider all kidney donors to be heroes. And they are the ones who are selflessly coming forward. They're not sick, but they are willing to undergo the surgery, and they basically will be out of work for almost 2 to 4 weeks. So them even agreeing is a big step for the transplant recipient and for the patient's family. However, it is very difficult, and it has to be altruistic, because you cannot force somebody to donate. Now, looking at all of this, then this is why I was actually part of the task force that looked at starting a disease donation program in Kenya, because it becomes much more easier and safer as well. So nobody has to have the difficult conversation with their family members that, look, I'm in need of a kidney. So we have already done the work. We have now given it to the parliamentarians, and the legal frameworks have all been sorted out. The ethical frameworks have been sorted out. Everything has been done. Now it's up to the parliamentarians now to actually make sure that this becomes a bill, and we set up a disease donation program, especially for those people who cannot meet, who don't have the family members who can donate a kidney for them. However, if you go through the whole process and we disqualify your family members and we don't get anybody else, then we do have a provision. Of course, it is subject to the ethics committee of the hospital. It is subject to, of course, the Ministry of Health also giving us the go-ahead, as well as now we're also planning to involve the Kenya Renal Association, which is the umbrella body for all the nephrologists and the nephrology nurses and all of those affiliated to nephrology. And we have actually been contacted by the Medical Council to help regulate all of that process. So that definitely is now going to open up more doors for people who cannot get donors to now look at non-related or unrelated unrelated people to come forward for donation. But of course, the process is going to be much more rigorous, because remember, as I said, that we do not want the vulnerable members of the society to be exploited. And that becomes extremely crucial for us.
Thank you so much, Dr. Bagha, for that insight. And I think the whole community in Kenya is looking forward towards the deceased donor program. And I'm sure so many patients are really going to benefit out of that. While patients are waiting for transplantation, many of them feel anxious, and they even get discouraged due to that waiting period as they are preparing. Maybe you can tell us what they need to do to stay physically and emotionally ready for the transplant while they keep waiting.
Another excellent question. As I said, that even when a person comes to my office with a potential donor, and the potential donor goes through all the tests and everything, there are times that we have had to postpone the transplant. And I'll give an example of one patient. I'll not mention his name. We had to postpone his transplant twice. One was for 6 months because of a medical condition that he developed. And then subsequently, the second time was for 3 months. And the important thing is you need to keep in touch with your doctor. You need to keep in touch with the transplant coordinator. So we are very lucky that at the MP Shah Hospital, I have transplant coordinators who keep in constant touch with the patients who are already on the waiting list and who have started the whole process of the workup for the kidney transplant. And you have to remember that the transplant, as I always mention, is never an emergency. Okay, people can live for long with dialysis. Of course, you have to lead a healthy life. You have to make sure that you eat healthy. You have to eat the right diet. Remember, when you're on dialysis, you have to have a low potassium, low phosphate diet. You have to restrict your amount of water that you're taking. You have to exercise as well, and that's extremely important. Exercise improves your mood, improves your blood pressures, it improves your circulation as well, and that is key as well. And then the other important thing is be in constant touch with your doctors. Even if your doctors tell you that the kidney transplant has to be postponed, they'll give you a good reason why. Remember, it is basically to make sure that you as an individual are safe. That when you do the kidney transplant, you come out of theater feeling much better. My patients actually tell me that, doc, after 6 hours when they wake up, they're actually feeling stronger. I mean, it is that dramatic after a kidney transplant. It is just amazing. I mean, we have had these videos and interviews taken of patients after the kidney transplant, and their experiences are so overwhelming. I mean, it is so gratifying when I hear somebody telling me that, doc, I felt stronger than I've ever been for the past few years when I've been on dialysis. And this is somebody who has just come out of theater 12 hours down the line. I mean, we did 2 transplants this week that has passed, 2 transplants in one day. And the second day, when I'm telling the patient, please, you have to drink a lot of water, he's like, I'm really struggling and I'm really scared to drink water. And I'm like, no, now you are at liberty to drink as much as you want. Yes. And he's like, look, it's amazing. I mean, I never thought that I would be able to take as much water as I want. I mean, we take so much for granted when we are healthy. I mean, when he saw his urine output, he was so amazed and he just kept on asking to see it. And it's the most gratifying thing that you'll ever see. I mean, the transplant field, clinical transplantation, is one of the most gratifying fields that you'll ever get into. I mean, as a healthcare professional. Yes.
I'm sure. Doc, before I ask you a question, let me ask you this. We have a comment in the section. This young lady is from the US, and she says, yes, I've had 3 separate kidney transplants. I still have my original 2 kidneys, a total of 5 inside me. Now, let me ask you, in all honesty, someone living in East Africa or Kenya, is that possible for them to get 3 transplants?
So currently, it is not feasible. We are technically working on somebody where we'll be doing second kidney transplant for them. It'll be the first in Kenya. But unless if it's done is when we can talk about it. But by the time that you are going to be doing the 3rd and the 4th kidney transplant, it requires a lot of expertise from the surgeon. Remember that a lot of times when we're doing the 3rd kidney transplant, we have actually utilized both the spaces in the abdomen. So now we have to use other spaces, and that requires a lot of technical expertise. And I'm glad that the ladies in the United States, where they are quite advanced, and I'm sure that in Kenya we are going to get there. I always say that it is not impossible. We just have to put our mind to it and get it done. I mean, that was how our first kidney transplant was done. And I'm sure that we'll be able to reach there very soon because we have dedicated doctors. We are hoping that we do get the expertise and people do train. It is all a matter of training and practice and going to centers with very high volumes. I mean, where I trained, it was a very high volume center in South Africa. So definitely, currently it is not available, this kind of a service. And this is why we do tend to refer these patients outside to a country of their choice. Of course, after carefully selecting the country and making sure that wherever they go, whichever center they go to is one of the best centers in the world so that they can also get the same service as well.
Mm-hmm. And let me ask you, doctor, for some patients, and we know this is a reality, cost is a huge barrier. Now, how can patients from low-income backgrounds navigate the transplant process, especially when donor availability and the cost of care become major challenges?
So that's another very an excellent question as well, because the cost of transplant at the MP Shah Hospital currently stands at around 17 to 18,000 US dollars. So it is quite challenging, but thankfully, at least now our Social Health Authority, what we call the SHA, which is a government insurance, at least covers around 6 to 7,000 US dollars. We are in talks with SHA that they should cover the entire cost for every patient who is living in Kenya. And the reason being, if you look at the cost of dialysis versus the cost of the cost of transplant versus somebody who remains on dialysis, by the end of the third year, you're actually saving quite a huge sum of money as a government, because in Kenya, the government sponsors the dialysis. Of course, you pay a very small and a minimum fee, like $5, and you get services that are basically worth more than that significantly. So I have drawn up models, economic models, health economic models comparing kidney transplantation and dialysis, and it clearly shows that patients who are on dialysis will end up utilizing a lot more money as compared to somebody who undergoes a kidney transplant. So if the government were to fully sponsor or reimburse the kidney transplant, they will be saving a lot of money and they'll be saving a lot of lives. So the direct costs of the dialysis by the time that you are in your third year post-transplant will be more. Then, of course, there's the indirect costs as well. Like, for example, as I mentioned, that once when somebody is transplanted, he or she gets back into the workforce immediately. So he's contributing to the tax. His number of hospitalizations reduce as well. For dialysis, you require access like catheters and fistulas. So you save a lot on that aspect as well. So once when the patient is transplanted, the government saves both the direct costs on the direct cost as well as on the indirect costs as well. So definitely we are in talks with SHA as well. The talks have been going on, and we want to see whether it will be feasible for the government to basically fully sponsor, because it is not fair for somebody to be looking for money, and healthcare is a right, is a human right for everybody. Yeah.
Thank you, Dr.
You're muted, Steve.
I'm sorry. I'm sorry. We have a comment before Brother Moses asks you his question. We have a comment and a MASH-B1G asks, does Kenya have a fully functional national organ donor registry or formal waiting list?
Okay, so the answer is no, because we do not have a deceased donor program in the country. So when you have a deceased donor program in the country is when you have a donor waiting list. So there'll be a national donor waiting list and a regional donor waiting list. We have done all of that in our paper that has been presented to our parliament and to our parliamentarians. So once when the deceased donation program sets up, then we'll definitely have a donor waiting list, a recipient waiting list as well. And it takes a lot in terms of the government to invest into all of that because of the human resource as well. We have very few nephrologists, unfortunately, in Kenya. Currently, we are only at 50. So we are working tirelessly around the clock, all of the nephrologists, so that we can actually see what we can do in terms of setting up a donor waiting list, a donor registry, so that it can become functional.
Wow. So you're saying that in Kenya, the entire population, there's only 50 nephrologists in Kenya?
Yes.
So that means it's a shortage.
Yes.
Wow. All right.
There is a shortage, yes.
Wow. Okay. To you, Brother Moses.
Thank you so much. Daktari, another quick one. When somebody is considering helping another person through kidney donation, what should they know before deciding to donate kidney?
Yeah, so another very excellent question as well. So when somebody
Sorry.
family member comes somebody who is A positive, or if I'm O positive, I can donate to any blood group. Okay, things as well to understand. And the other important thing, and you don't have diabetes as well. And once when everything is established, and then we now start the workup for the donation process. So here at the MP Shah Hospital, we do the whole workup in 3 steps. So the first step basically is going to be the basic tests that we do. And once when the basic tests come out to be normal, then we proceed with the second step, which is basically your genetic testing, to just put it in layman's terms. But this involves your HLA typing, the tissue typing, to make sure that your kidney will not be rejected immediately by the recipient. We do the cross match, we do the DSA testing. And if those go through, then we basically move to the third step, or the third stage, which is now involving the scans and everything. The reason why we do it in 3 steps, one is because of the finances. So we can't do all of the tests in one go because they're quite costly and the patient has to pay out of pocket. So in case if we find any problems in the first step only with the basic tests, then we put a halt to it, because we don't want the recipient now to spend all of their money immediately, because remember that they still have to now look for the second donor or the third donor as well. So this is the steps that somebody goes through. Of course, the donor has to still undergo a lot of counseling. Now, we have our own counselor within the hospital. And then to make sure that everything is okay and there's no coercion involved, there's no exchange of money involved, because we are a JCI accredited hospital and our transplant program is JCI accredited. I'm sure Steve will know about the JCI accreditation because it's mandatory for almost all the American hospitals to have it. So MP Shah is a JCI accredited hospital. Yes. And our transplant program actually scored on the highest this thing when we were assessed recently. And our donors go to an external donor advocate as well to make sure that everything is okay. And that donor advocate is not part of the hospital or part of the transplant team. And it's only after we get a go-ahead from the donor advocate is now when we present the case to our ethics committee. And when the ethics committee tells us that we can proceed with the transplant is when we proceed with the transplant. Yeah.
Yeah, and I just want to add, Doc, I just looked up the population, 58.8 million people. And out of that population, how many would you say deal with kidney disease? And only 50 nephrologists that deal with such a huge population, I'm sure has to be very, very challenging.
Yeah, so as the current statistics stand, 10% of our population have got chronic kidney disease, that is 5.8 million, out of which 10% require treatment for the chronic kidney disease, which is 580,000 Kenyans. And currently we have approximately 25,000 people with end-stage kidney disease. Of course, this is grossly underreported. Remember, a lot of our patients don't actually reach the hospital. It's very unfortunate that our health-seeking behavior in sub-Saharan Africa is still not the best. So people will still assume that whatever they're feeling is because of either old age or overworking, working too hard. So they don't go to the hospitals, unfortunately. They don't get tested. And as I always mention, I also run a YouTube channel as well. And I always keep on telling people that kidney disease, especially in the early stages, does not have any signs or symptoms. You can be having stage 4 chronic kidney disease and you are totally asymptomatic. Okay? The only way you can know whether you have kidney disease or not is by doing 2 simple tests. One is by doing a blood test, checking what is called the serum creatinine, which is a chemical in the blood. and the other one is by doing a urine test, which are very simple tests and they're readily available. But as long as you don't go to the hospital and get tested, you will never know whether you have kidney disease or not. So nobody wakes up and gets kidney disease, especially in the adults. It goes through several stages. You have to have the kidney stress, kidney injury, kidney damage, and then it becomes chronic kidney disease. And even the chronic kidney disease goes through several stages, stage 1 to stage 5. Now, up to stage 4, you may be totally asymptomatic. The only symptoms you are getting is you're just feeling tired, or you find that your legs are swelling a bit. You're like, oh, I stand a lot during the day. So that's the reason why my legs are swollen. But not realizing that that possibly could be one of the symptoms of kidney disease. Yes.
Wow. Doc, let me ask you, for some patients, cost is a huge barrier. How can patients from low-income backgrounds navigate the transplant process, especially when donor availability and the cost of care become major challenges?
So it becomes quite challenging, and unfortunately, there's no simple solution. I mean, now the government through the Social Health Authority has agreed to fund the medications post kidney transplant, which is a big step. Trust me. I mean, a couple of years ago, this has started last year. Before that, they were not funding it, and patients had to pay out of pocket. So the cost of the transplant medications go anywhere between $300 to $400 a month. Now, somebody who's paying $5 and getting free dialysis for the whole month is suddenly now asked to pay $400 a month, and suddenly they'll be like, look, even though all of this that you told me is good, that when I do a kidney transplant, everything is good, I will live longer, my quality of life will improve, but I can't afford those $400 per month. So they actually step back and don't go for the transplant because of that reason. So now that the government has actually started noticing that there is a benefit of getting these patients transplanted, of getting everybody getting a transplant, and they've started paying for the post-transplant medication, is a big step. How else we can basically do it and convince the government to basically fully sponsor the kidney transplant itself. In the meantime, unfortunately, they will still have to look for family members. I mean, there's something we call harambe in Kenya, whereby people get together, we donate money. But remember, it's not only about the donation of the money, it's also about the post-transplant care as well. And I feel that the government really needs to look into this, especially for our kidney disease patients, for patients with kidney disease and patients on dialysis, because it is very costly to have kidney disease in Kenya, unfortunately. I mean, hats off to the government for providing the dialysis services at a very nominal cost of $5 a month that the patient has to pay. It has been a game changer. I've been practicing nephrology for a very long time as well, and I can tell you that before the government was reimbursing, we used to have only around 300 to 400 patients on regular dialysis. We used to have 6 centers of dialysis in the whole country. Patients sometimes had to travel 100 kilometers to get dialysis twice a week. I mean, people used to die waiting for dialysis. Now we have more than 8,500 patients on dialysis. We have 250 centers of dialysis in the country. So yes, I mean, these are small steps, but it shows us that we can do it if we work together, and the government can do it as well. Yes.
Wow. All right, Brother Moses.
Thank you, Steve. Daktari, patients always hear about the risk, about many not fully understanding them. What are the biggest risks patients should know about before going for transplant surgery?
Yes. So the surgery, remember, both for the donor and the recipient, is relatively safe because we do extensive workup for both the donor and the recipient. Okay? So that's very important. And this is why it takes some time before the patient actually get transplanted from the time they come with the donor. Okay. Now, the risks are basically for the recipient is mainly the risk of infections. Now, remember, when we are doing the transplant, your body can reject the new tissue or the new organ because it is foreign. So what it does is that the body now starts attacking the organ. So it sets its police officers, the white blood cells and the B cells and the T cells, to now destroy the organ. So the only way that we can safeguard the organ is by suppressing that immunity. Now remember, that same immunity is used to fight diseases, to fight bacteria, to fight viruses. Okay? So as a recipient, you are at a very high risk, especially very early on, the first 6 months post the kidney transplant, to get diseases or bacterial infections or viral infections. The risk still stays on, but it goes down because we tend to reduce the strength of the medications and the dosage of the medications as you go along. So you have to be very careful in that aspect when you're a potential kidney transplant recipient, that you should know that even after the transplant, you still have to safeguard yourself from getting these infections. Number two, the risk of rejection is always real. So you have to be compliant to your medications. That is extremely important, and I can't overemphasize this. And this is why you have to work very closely with your transplant team. Remember, the transplant team is not only the nephrologist, we have the transplant coordinator as well. And in case if you're getting any problems whatsoever, for whatever reason, please communicate with your transplant team, because we do have some resources available to us that can help us help you. We do know the pharmaceutical companies. We can request them to assist you while you now try to sort out whatever the problems are. You need to come for regular checkups. What happens is, once when you are off dialysis after 6 months, 12 months, people are feeling perfectly fine. They stop the medications. They stop coming to the clinic. Then after 6 months to a year, they come again with end-stage kidney disease. The graft has already failed. So it's very important to realize that you are not, yes, you're not coming to twice a week to the dialysis unit, but you're supposed to come regularly to your nephrologist so that he or she can assess and make sure that everything is okay. Your kidney is functioning fine. If there's something wrong, we can address it immediately. For the donor, they don't need to be on regular medications, but they need to eat healthy, lead a healthy lifestyle, exercise regularly, and even they need to come for checkups regularly, every 6 months. It's important for them to come for a checkup, to do the kidney function test, to make sure that they are doing fine. So it is not that once when the transplant finishes and everything has gone well, then you disappear. No, you still are supposed to take care. Remember, the most common cause of kidney disease is diabetes and hypertension. By doing the kidney transplant, we're not curing the diabetes or high blood pressure or the hypertension. So you still have to control your blood pressure, you still have to control your blood sugars. So what damaged your kidneys in the first place, which is your high blood pressure and the high blood sugars, can also damage the new kidney as well. So you need to take care of that as well. Yeah.
Back to you, Steve.
Oh, it's on Tabitha.
Thank you so much, Dr. Bagha. You've talked about the adherence and even the follow-up, and you've really emphasized concerning the recipient and even concerning the donor. But we also have patients who are listening right now who may feel hopeless, especially if they think the family donor requirement has blocked their chances. What message would you give to this patient and even their families?
No, please don't lose hope. Yeah. I mean, I always say trust in God first, and then talk to your team. That's the most important thing. Talk to your nephrologist, because remember that we do allow in exceptional cases where you don't have a donor, that if a friend of yours comes forward and we have to verify everything because of obviously what has been happening, that we have to verify every single thing, and we are being audited by the government. Every transplant facility is being audited by the government now. That whatever we do has to be the right thing. Yes, but as I said, that in exceptional circumstances where you do show that nobody in your family can donate, the potential family members have gone through the whole donation process and they have been disqualified for donating, and somebody whom you know for a long time has come forward, somebody who knows you very well, not somebody whom you tell me that you just met a month ago and has suddenly decided to donate. I mean, of course, there are red flags all over the place about something like that. Yes, and it has happened. I mean, a lot of patients come to me with, I've been doing transplants for a long time, so I actually know what and how to pick up these red flags and everything. But it doesn't mean it's the end that we can't do it. We can do it, but of course you have to show us that we have pursued the right way, which is getting all your family members. Your family members can attest to the fact that they are not able to donate for one reason or another, and of course we will test them. And then we always, as I say, that don't lose hope, because we are praying that as Kenya Renal Association, we are working hand in hand with the government as well to start the whole disease donation program as well. I mean, these things are there, and I'm sure that they will come to fruition. So please don't lose hope. Yeah.
Thank you. Over to you, Brother Steve.
Okay. Dr. Bagha, I want to ask you two questions. The first one, after the transplant is done, the journey we know is not over. How important are medication adherence and follow-up appointments after transplant?
No, that's an excellent question, Steve. So even before we do the transplant, the recipient and the donor undergo quite a number of counseling sessions, both from the nephrologist as myself, from my transplant coordinator. The importance of adherence, the importance of making sure that you take your medications on a daily basis, and you have to show us that you will be adherent to your medications. This is why I mentioned that even if for whatever reason, we're all human beings, things can happen. Somebody can lose a job, somebody can get robbed. For whatever reason you can't buy the medications for that month, please let your team know, let your nephrologist know, let your transplant coordinators know. We are always there to assist in whatever way we can. Yeah. The minute you stop taking your medications, your body will now start attacking the new kidney. And once when it starts attacking the new kidney, even by the time it is picked up, a lot of damage already has happened. So you need to make sure that you are taking your medications regularly. You need to come for your follow-up visits regularly as well. It's extremely important. Okay? Yes, yeah. I can't overemphasize that.
All right. And my second question is, in your experience, doctor, what are some of the biggest reasons many ordinary Kenyan patients miss out on transplant opportunities?
Yeah, so another very important question. Surprisingly, a lot of people don't know that we do kidney transplants in Kenya. It's very surprising. And we've been doing kidney transplants for a long time, okay? One of the biggest reasons why why people don't get a kidney transplant, the biggest reason is obviously the cost. Yeah, I mean, the financial burden is a lot, unfortunately. And so that is one of the biggest reasons. Two is lack of a donor. The third reason is sometimes these patients tend not to be eligible for a kidney transplant, either because of a medical condition they have, like let's say somebody has an active infection going on or an active cancer going on, or they've had a heart attack or a stroke. And this has to be treated first before we can actually proceed with a kidney transplant. Yeah. So those are the most common reasons why somebody will not.
Wow. Dr. Bagha, as we come to a conclusion to our show, one final question for you is, what do you want fellow Kenyans to know who just been diagnosed with kidney failure pertaining to the transplant process?
Yeah. So number one, if you have been diagnosed with kidney failure, remember it is not a death sentence. Okay. Dialysis is available, and dialysis is available for free at all the facilities that have dialysis units. Okay. So don't lose hope. Number two, please ask your kidney specialist about a kidney transplant and whether you qualify for a kidney transplant or not. And that is extremely important. So you really have to ask your kidney specialist, you have to work hand in hand with, okay, about a kidney transplant. There's something we call a preemptive kidney transplant as well, especially if you've been on follow-up with your nephrologist, you've been having stage 3, stage 4 kidney disease. Please ask them about what is called a preemptive kidney transplant, meaning that when you reach end-stage kidney disease, we don't transplant you. What we do is that we work you up for a kidney transplant so that by the time you're reaching end-stage kidney disease requiring dialysis, you're already on the list and you're already been transplanted. So that way you don't ever reach the stage of dialysis. That's called a preemptive transplant. And we do that in Kenya as well. The other thing is try to ask your family members, talk to your family members about donation. There are kidney transplant support groups that we have in NP Shah Hospital, where people share their stories. You can always join those groups. It's for free. You can join my YouTube channel as well. It is for free as well. All that information is out there. So please don't lose hope when you are diagnosed with kidney failure. For those who have not been diagnosed with kidney failure, please remember that your kidneys are very precious organs. Please learn to protect them. Learn to know whether you are at risk or not for kidney failure or kidney disease. If you have diabetes, if you have high blood pressure, if you have family history of chronic kidney disease, then your risk is much higher for developing chronic kidney disease. So just go and get tested if you have these risk factors. Avoid over-the-counter medications like your non-steroidals. I know these are prevalent even in the US. Even here, you say you have a headache, you're given Brufen, ibuprofen, or you're given diclofenac. Those are harmful for the kidneys. Don't take any herbal medicines, okay? Those are also harmful for the kidneys as well. Exercise regularly is protective for the kidneys, is protective for the heart as well. Hydrate yourself well, very important, okay? Control your blood pressures, control your blood sugars, because those are the most common causes of kidney failure. Yes.
Wow. Thank you, Doc. I really appreciate you sharing your words of wisdom and knowledge. Moses or Tabitha, do you have anything that you want to say to Dr. Bagha before we conclude our show?
Thank you so much, Dr. Bagha, for coming on the show to share your insight. I've seen somebody has said that you share your contacts. You can also share maybe your Facebook page, your YouTube channel, so that they can follow you. Thank you.
No, definitely I will. I think Moses has all of them, so he can share them. Yeah. Okay.
Yeah, definitely, Dr. It's my pleasure. I'll do it.
Thank you.
Brother Moses, do you have anything you'd like to say before we conclude?
Yes, may I take this opportunity to thank you all, especially Dr. for taking your time to make this broadcast a success. We are so grateful, and we are glad to host you once again. Thank you so much.
Thank you. It was my pleasure.
Yes. Dr. Bagha, we definitely had to bring you back. One topic that I would like to discuss in the future, if you have the time, is herbal remedies. We're seeing a high escalation of people promoting herbal supplements to address kidney disease, and we know that these type of supplements can maybe or possibly do more harm than good to the function of the kidney. So we would love to bring you back to discuss that and the, excuse me, and the, I guess the, I'm losing my thought, the, in Kenya, Brother Moses, help me, the, when it comes through the,
Steve mentioned that herbal medicine are quite rampant. He's noted that. Actually, there was a time we did discuss with him, and the vibrant market in Kenya of herbal medicine that we've always encounter that even convince the most unsuspecting clientele to end up indulging in such medicinal options. So I think that is what you meant, Steve.
Yes, and even through past generations, how maybe looked upon when it comes to kidney disease as witchcraft or something like that, and use different type of supplements to try to heal it. So that's in the future I would like to discuss if you have the time to discuss that.
No, definitely we can do that.
All right, great. So Dr. Bagha, thank you so much for sharing your time, your knowledge, and your compassion with us today. We learned that kidney transplant is not just a surgery. It's a journey that involves preparation, hope, support, and lifelong follow-up. To every patient waiting for a transplant, to every family walking this journey, and to every potential donor considering the gift of life, please stay informed, stay hopeful, and stay positive on this journey. And we want to thank everyone, Brother Moses and Tabitha, for joining us today. This has been Kidney Hub East Africa, where we educate, advocate, and support and empower. So Dr. Bagha, thank you so much. Brother Moses, Tabitha, we see you soon. Until next time, stay informed, stay healthy, and keep supporting kidney health across East Africa. This has been Kidney Hub East Africa. Thank you and good night. Thank you again, Dr. Bagha, Brother Moses, and Sister
Thank you.
Tabitha. We'll see you soon.
Thank
See you, everybody.
All right, everyone. Thank you.
Right.
Hello, I'm Darren. We have breaking news. More than 600,000 Americans have kidney failure. While the number of people with kidney failure is enormous, the number of people with its precursor, chronic kidney disease, is staggering. An estimated 31 million Americans, or about 10% of the US population. Diabetes and hypertension cause 2/3 of all cases of kidney disease. 1 out of every 3 Americans is at risk for kidney disease, and kidney disease is now among the top 10 causes of death in the United States. In addition, 9 out of 10 people with early to moderate kidney disease don't know they have it, putting their health in jeopardy. Are you at risk? For more information, contact urbankidneyalliance.org. The life you save may be yours.